Why is it so crucial to understand the different types of insulin and their characteristics? Well, in the world of medicine and healthcare, insulin is a fundamental player. It's not just about knowing the names, it's about understanding their onset, peak, and duration. Insulin is a hormone that regulates the amount of glucose in the blood. The body's cells need glucose for energy, but it can't enter the cells without insulin. Now, there are several types of insulin, each with unique characteristics. The first type is rapid-acting insulin. This insulin begins to work about 15 minutes after injection, peaking in about 1 hour, and continues to work for 2 to 4 hours. It's often used before meals to control spiking blood glucose levels. Coming up next, we have short-acting, or regular insulin, an essential topic in nursing you'll need to know to ace your NCLEX. Brought to you by the experts at NGNC Institute. This type of insulin usually reaches the bloodstream within 30 minutes after injection, peaking between 2 to 3 hours post-injection, and has a duration of 3 to 6 hours. It's often used to manage blood glucose levels during meals or snacks, or for immediate high blood glucose management. Remember, with NGNC Institute, we are with you every step of the way until you pass, all for a one-time fee. Stay tuned for more. Intermediate-acting insulin, also known as NPH, hits the bloodstream about 2 to 4 hours post-injection. It peaks 4 to 12 hours later and is effective for about 12 to 18 hours. This type is typically used to control blood glucose overnight, while fasting and between meals. Long-acting insulin reaches the bloodstream several hours after injection and tends to lower glucose levels fairly evenly over a 24-hour period. It's often used for baseline insulin needs. Finally, there's premixed insulin, which is a combination of two different types of insulin. It can be a mix of a rapid or short-acting insulin and an intermediate-acting insulin. The onset, peak, and duration of effect can vary greatly depending on the mix. These different types of insulin allow healthcare providers to tailor diabetes treatment to individual patient needs. To sum up, understanding the different types of insulin and their characteristics is vital. Rapid-acting insulin is fast and fleeting, with an onset of about 15 minutes and a duration of 2 to 4 hours. Short-acting insulin takes a bit longer to kick in, but lasts a bit longer, with an onset of about 30 minutes and a duration of 3 to 6 hours. Intermediate-acting insulin takes even longer to start working, but lasts much longer, with an onset of 2 to 4 hours and a duration of 12 to 18 hours. Long-acting insulin takes several hours to start working, but provides a steady level of insulin over a 24-hour period. And premixed insulin is a blend of two types with varying onset, peak, and duration times. Remember, insulin is a key player in the body's function, and understanding its different types and their characteristics is crucial in the healthcare field.